Good afternoon, ladies and gentlemen. It is my great honor to welcome you to the session this afternoon as we discuss youth innovation to eliminate malaria in Africa. My name is Dr. Ndifanji Namaja, and I'm going to be your moderator this afternoon. So we've got a very amazing and diverse panel and also vibrant key speakers that are going to address us this afternoon. But before we get into the session, I'd like to remind our audience that you're able to engage the moderator, but also the panelists using the chat feature. But also this session is being recorded and is going to be available as a resource after the session. Now, to present to us the opening remarks, I'd like to welcome Ms. Joy, who is the Executive Secretary to the Africa Malaria Leaders Alliance. Thank you very much. Over to you, Ms. Joy.
Thank you so much. I welcome this opportunity to engage with you today. I would like to recognize the representatives of the African Union who are here, the program coordinator for AIDS Watch Africa, and of course, the head of youth development at the AU Commission. Now, the most important people with us today are the youth. So today, I am absolutely delighted that we are joining the youth today and the international community to commemorate International Youth Day. And just a few days ago, His Excellency President Uhuru Kenyatta, the chair of the African Leaders Malaria Alliance, launched the inaugural Kenyan National Malaria Youth Army, an important step in mobilizing a continental youth army to harness Africa's demographic dividend. Indeed, Africa's renaissance cannot be realized without adequate investments in our young people who constitute up to 70% of the continent's population. He outlined a bold and ambitious 4-point plan to help eliminate malaria on the continent by March 2020. That is by March 2030, by the end of 2030, I beg your pardon. President Kenyatta placed data digitalization and the youth at the center of Africa's response to malaria. Indeed, the use of real-time data through country scorecards, management tools, and overall democratization of the fight at regional, national, and community levels has to be led by the youth. And it is our hope that the youth will be able to use the AMA Scorecard Hub to drive this process. The third call by His Excellency was for the creation of at least 15 malaria councils and funds, engaging key stakeholders, including young people. 5 have already been launched, another 3 have been announced, and an additional 7 are under development. The President called for the close engagement with the regional economic blocs in Africa to address sub-regional agenda. Here again, the engagement of young people is key. 5 memoranda of understanding with the regional economic blocs have been signed, and we are already undergoing the process of implementing these MOUs. Now, the creation of the Malaria Youth Army, working with existing youth leaders across the African continent to champion youth engagement and resource commitments for malaria elimination, is a cornerstone of this 4-point agenda. But we must note that despite an unprecedented global COVID-19 pandemic, progress has been made in this 4-point agenda. We have been inspired by the response to COVID-19. People have adopted new behaviors to protect themselves and their communities, like wearing masks, like physical distancing. And public-private partnerships have been developed in just 1 year. Vaccines that will rid the world of COVID-19 are being administered. Regrettably for the African continent, vaccine nationalism is impeding rapid access for most of our people on the continent. And as a result, young people on the continent remain unvaccinated, and more are suffering severe illness. This is a symptom and just one indication of an unfortunate outcome of a much larger problem. Africa needs to further develop its own world-class pharmaceutical and medical commodities manufacturing industry. A key bottleneck we have encountered during the COVID-19 pandemic is not limiting itself to the vaccines, but there has been difficulty in securing essential health commodities, including malaria diagnostics, treatments, vector control tools, in a timely manner, especially since most of these are manufactured outside our continent. We therefore urge the youth to work together with their governments and the finance and development sectors to ensure that these commodities are manufactured in Africa. The Zero Malaria Starts With Me campaign, launched by the African heads of state and government, is now operational in 21 countries. This International Youth Day, I would like to urge countries on the African continent to build a social movement to end malaria through the Zero Malaria Starts With Me campaign that is driven by the young people, working at community level, at national level, at sub-regional level, through the regional economic blocks, and regionally and globally. Youth have a historic opportunity to contribute and strengthen cross-border collaboration, including data sharing, joint implementation of interventions, research, manufacturing, as I said earlier, sharing of best practices. Young people can engage members of parliament for enhanced accountability in their oversight, using the data and consistently making sure that at constituency level, at national level, parliaments and their members are held responsible and accountable for results. We are applauding the youth's participation and their keenness for their countries to harness this democratic dividend. The Youth Army will drive a movement to fight malaria and also contribute to improve maternal, newborn, and child health across the continent, achieving the transformational agenda that is the Africa that we want. We are looking to the young people to lay a strong foundation for Africa's inclusive economic growth, poverty reduction, peace and security, and a shared prosperity. We commit as ARMA to work with you, the young people, across the continent in the fight against malaria, as we ramp up our efforts through the African Youth Advisory Council to advance the malaria and universal health coverage agenda. I join hands with the international community, with the AU, with the regional economic blocs, with countries, with communities, to underscore the need to enable the young people by making local, national, and global institutions more inclusive for the purpose of strengthening their capacity and relevance to achieve regional, national, global community action. It is critical that we protect the gains that we've made in the fight against malaria. And we will only do this with the engagement and the leadership of the young people. Zero Malaria starts with me, and Zero Malaria starts with the youth. I thank you.
Wow, very powerful remarks from Ms. Joy, really setting the tone and the foundation for the panel this afternoon, and really just highlighting the power of youth innovation, the power of youth engagement, and also partnerships. We have seen the power of partnerships in the fight against COVID. And again, Ms. Joy just reminding us the power of engaging the youth, the power of innovation, and the power of partnerships in the fight against malaria. And just as she mentioned, the call for applications is open for Malaria Youth Champions. AMA has opened the application questions, and the call is going to be available in the chat feature as well. So we have seen so many youth from across different countries. Let us apply. Now, at this point, with the welcome remarks on behalf of the African Union Commission, let me welcome Mr. Musaf, who is the coordinator, the program coordinator for Africa AIDS Watch and also Health Financing. Over to you, Mr. Musaf, and welcome this afternoon.
Thank you, Dr. Nifanji. Good afternoon, good morning, good evening, everyone. I am representing Dr. Margaret Agama Anyete, the Director for Health and Humanitarian Directorate, who has another commitment equally important. And I'm happy to be with you on this very unique occasion. So I am going to read her statement. Excellency Mrs. Joy Fomafe, Executive Secretary of ALMA, ladies and gentlemen, the African Union joins the international community in commemorating the International Youth Day under the theme Transforming Food Systems, Youth Innovation for Human and Planetary Health, highlighting the fundamental truth that success of such a global effort will not be achieved without the meaningful participation of young people. It is universally acknowledged that there is a need for inclusive support mechanisms that ensure youth continue to amplify efforts collectively and individually to restore the planet and protect life. Defeating malaria is a key foundation for protecting lives, freeing up hospital beds, contributing to stronger health systems, poverty reduction, and improved economic outcomes. Through active engagement of youth innovators in the health sector, there is intergenerational dialogue. This intergenerational dialogue aims to provide a platform for young people to connect with senior leaders in the health sector. The AU Commission upholds the centrality of youth empowerment for health as attested in the Africa Health Strategy and the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030 specifically. These policy frameworks identify the need to empower youth with skills and knowledge to attain good health and prosperity. In the context of the African Union Constitutive Act, the African Youth Charter, and the AU Roadmap on harnessing the demographic dividend through investments in youth, and Agenda 2063 and Agenda 2030. I encourage African Union member states to strengthen implementation of these policies and continue to implement youth-friendly services and diseases control programs for malaria. Ladies and gentlemen, Africa is marching towards a more prosperous future in which all its citizens, youthful, old, male, female, rural, urban, religious, are moving, working harder to empower themselves and their communities to realize their full potential. Needless to say that a future that we imagine is based on a healthy citizens, the Africa we want as envisioned in Agenda 2063. 70% of those citizens are youth. It is in this context and with far-sighted leadership that His Excellency President Kenyatta has put the youth at the center of his bold and ambitious agenda to eliminate malaria and address the broader health and development agenda in Africa by 2030. While many-sided and simultaneous steps are needed to achieve this bold vision, there are some very clear and obvious steps that must be taken without delay. This responsibility rests with all African citizens and leaders alike at the continental and regional levels, and especially within countries, to ensure we adequately invest in the development of our continent's greatest asset, its young people. A peaceful and secure Africa requires an empowered generation of youth. A well-developed continent depends on the education and skills of Africans, especially the youth, and none of our aspirations would be met if disease and poor health continue to affect millions of our citizens. With 70% of Africa's population being youth, it is no surprise that at the dawn of our implementation of both Agenda 2063 and 2030 Agenda for Sustainable Development, African heads of state and government have committed to harnessing the demographic dividend through investment in youth. The extent to which African governments are able to transform education and skills development, health and well-being, empowerment, as well as employment and entrepreneurship lies at the heart of this march towards progress, sustainable peace and development. Ladies and gentlemen, I am convinced, having worked in the health sector for decades, that we will not make much progress if we do not recruit a cadre of youth who will bring in their passion, their knowledge, their skills, and determination to end malaria and contribute to ending these pandemics that we have knowledge on how to end. We are now living in the age of pandemics, as demonstrated by Ebola and COVID-19, and we cannot afford not to take action in ending malaria, AIDS, and TB. Key investment in the youth of Africa today are critical to Agenda 2063 and game changers to elevating Africa to be a strong and influential global player. Just to put everything into perspective, the continent's population reached 1.2 billion in 2015 and is projected to grow rapidly, reaching 1.7 billion in 2030 and more than double by 2050 to 2.5 billion in 2050 and 3 billion in 2063. Africa's share of the global population will increase from 60%, its 2015 level, to more than 29% in 2063. More remarkable is the fact that about 46% of the 1.3 billion increase in Africa's labor force over the period 2015-2063 will be young people aged 15 to 34, averaging 12.1 million a year. Young people are driving actions to secure an equitable, healthy future. Their actions today will determine maternal health, education levels, and build a strong foundation for health for Africa's human capital development and the socio-economic transformation of Africa, positioning Africa as a competitive player in the global political economy. We must devise ways of reaching every segment of the youth population with the services they require, recognizing that one size does not fit all. Ladies and gentlemen, the global theme of this year, International Youth Day, Transforming Food Systems, Youth Innovation for Human and Planetary Health, outline the key challenges that young people should address with interlinkages embodied by the Agenda 2030 and Agenda 2063, including healthcare. It has been acknowledged that there is a need for inclusive support mechanisms that ensure youth continue to amplify efforts collectively and individually to eliminate malaria and promote good health and well-being of adolescents now and in their adult lives, which greatly depend on key education opportunities and access to quality health services that help them stay healthy, empowered, embracing gender equality norms, and demanding rights. We must amplify opportunities to acquire knowledge and equitable access to quality healthcare services. Ladies and gentlemen, I would like to emphasize that Africa has the youngest population in the world. The continent's youthful population presents a powerful opportunity for accelerated economic growth and innovation. However, great economic productivity will only manifest when young people are healthy, well-educated, and empowered to seize opportunities and thrive. Let us continue to work together towards empowering more youth to champion the elimination of malaria in Africa by 2030 and overall good health and prosperity in the continent. As I conclude, ladies and gentlemen, harnessing the demographic dividend in Africa presents a strategic opportunity to realize the aspirations and goals of Agenda 2063 and Agenda 2030. Africa is committed to transforming its large youth population into a development asset, building on previous decisions of the African Union Assembly on youth empowerment. We are on a firm path to achieve the development trajectory to build the Africa that we want. Zero malaria starts with me. Zero malaria starts with you. I thank you.
Thank you very much for the powerful remarks, Mr. Mustaf. Indeed, zero malaria begins with me and zero malaria begins with you. Now, at this point, you know, the Zero Malaria campaign has taught us one thing. It has taught us the power of art. It has taught us the power of culture, and it has taught us the power of telling our story to influence the fight against malaria. At this point, with spoken word, I'm going to invite Ms. Munira Muhammad, who is a youth advocate from Nigeria, and she's going to share her spoken word. Over to you, Ms. Munira.
Yeah, thank you. Such powerful opening remarks. Thank you for having me today. My name is Munira Muhammad Abdu. I am from Nigeria, and I am very passionate about driving action from governments, youths, and communities in order to accelerate malaria prevention and treatment so as to save lives. My journey started 2013 when I was invited to join the ELCA malaria campaign back in Iowa, in Burlington. I was quite surprised at first because the invitation came because they believed I had more knowledge on malaria simply because I was from Africa. And my first thought was, malaria is really not a big deal though. Why are they blowing it out of proportion? However, when I joined the team and I started reading through the statistics, I was astonished by the devastating impact of the disease on the African continent. Because I only thought of malaria as a simple disease that comes and goes seasonally, especially during the rainy season. And frankly, that is the belief for most people here also. So my experience with ELCA inspired me to reach out to my community to render all the help I could. And so I co-founded End Malaria with a group of youths in my community. It was in collaboration with the state's primary health care. It was a really tough and difficult journey that actually took us a year of planning and a lot of setbacks. We had a lot of forward and backward moments. It was quite challenging because working with the community that actually believes that it's not the disease is not as deadly as we're making it to be was actually a big challenge to actually get people to take us seriously. And finally, in 2016, we were able to be registered as an organization, and we began our programs. So at End Malaria Nigeria, our goal is prevention and case management of malaria in rural communities in Taraba State, Nigeria. We launched our first program in rural secondary schools where we trained students on malaria prevention methods and case management. So our trainings included seminars on adverse effects of malaria, its symptoms, importance of insecticide-treated nets, and dangers of self-medication, because along the line, we discovered that most patients of malaria actually do self-medicate a lot, and it tends to be a huge problem because you don't know at what rate you have that malaria to actually get the right treatment for you. So at the end of those trainings, the participants became what we called End Malaria Soldiers, where we have them conduct sensitization programs on malaria prevention and treatment seeking strategies in their own communities. And we received a lot of feedbacks from them. And through this program alone, we have been actually able to reach out to over 1,000 people through our End Malaria Soldiers. And so we moved on to another program which focuses on communities, where we launch community sensitization campaigns on malaria prevention through the use of insecticide-treated nets and community sanitation. We found out that the prevalence of mosquitoes in certain areas can be linked with poor sanitation in those communities. So we focused our attention more on community sanitation in order to reduce the prevalence of mosquitoes and also reduce the prevalence of malaria in those communities. So after those sessions, we launched intervention campaigns in rural communities where we provided free malaria tests. We administered drugs and gave out insecticide-treated nets to pregnant women and children. And malaria focuses more on women and children because we believe they are the much more vulnerable group to be affected by this disease, according to the statistics from the World Health Organization. So far, we have been able to reach out to 1,500 women and children through our intervention campaigns and over 4 different villages so far. Today, I am proud to be part of a generation that is fighting so hard to end this disease. My goal is not to only find new ways to eradicate this disease, but also to engage more youths in this fight as well. I'm happy to be here, and thank you for making me a part of this conversation. I would also like to say zero malaria also starts with me, and it starts with you. Thank you.
Thank you very much for sharing your story. That is very remarkable. We can see that the youth are in the front lines. We have seen that the youth are in the front lines fighting malaria as advocates, as health workers, as researchers. Now, at this point in time, I'd like to welcome our panelists. So we've got an amazing and vibrant panel from AMA, the African Union, but also from AMREF. So I'm going to start with Dr. Esho, from the Director of AMREF Health Africa. Good afternoon, Dr. Esho.
Good afternoon, Dr. Dipanji.
Thank you very much for joining us this afternoon. So this year, we have witnessed the launch of the AMREF Health Africa Global Youth and Adolescent Strategy, which is a collaboration for youth leadership in the lasting change, fighting lasting change in Africa. So what lessons from AMREF, with lessons from AMREF, how can we promote youth to be leaders in the health agenda? What lessons has AMREF picked up in developing this strategy?
Thank you very much for your good question. I'd like to begin by saying that I'm here representing Dr. Gebenje, who's the Group CEO for AMREF. So I'll start by saying that Africa is at a tipping point, and that it is the only region where the youth population is growing rapidly, and more than 75% of Africa's population is under the age of 35. So for us to harness this growing demographic and for Africa to reap the benefits of the demographic dividend, and especially in achieving equitable access to healthcare, we needed a paradigm shift as an organization. So we have transformational leadership where the power of change includes deliberate collaboration with adolescents and with the youth. It is for this reason that AMREF Health Africa is increasing its focus and investments on this great population. Over the last few years, we've had specific programs with the youth, including our work with Y-ACT, which is Youth in Action, an advocacy and social accountability network that now covers 21 countries. So our work with the youth in communities also to end harmful practices that affect adolescent girls and young women across Africa. Our focus is on enabling the youth to be leaders in the health agenda, and this is underpinned by acknowledging youth agency is a right and it is no longer an option for Africa. With the growing youth population, youth agency enables young people to become architects of their own lives. As Africa's largest indigenous health NGO, we are creating an enabling environment that includes investing in capacity to participate in policy advocacy and programming for the youth to realize their potential and to make decisions about their lives and their health. We also acknowledge that meaningful youth engagement goes beyond giving the youth a voice. It's about empowering them to tap into their agency to effect change. So we do this by transforming our internal systems and processes to enable youth to take up positions of leadership and to participate actively in the organization's processes. We also strengthen their capacity in leadership in the health sector and ensuring that programs have a youth focus are developed with and by and for the youth. So the strategy is intentional about advancing youth agency in the health agenda. It promotes data-driven action for youth-led programs and policies, and it also maximizes youth potential and minimizes youth vulnerabilities in health through programs, learning, and strategic partnerships.
Thank you very much for that. I mean, you have brought up a very powerful thing and something that I really resonate with, capacity building. I believe that there's always so much talk about youth engagement, get youth in the front lines, but there's not really a lot of effort that is put in building up the capacity in the youth to equip them to be able to get in the front lines. And at this point, with what you have said, I really just want to take it back to the EU with Mr. Ishmael. I just wanted to know what role does the African Union Commission play to promote youth engagement in youth innovation? What role is the African Union playing? Over to you, Mr. Ishmael from the African Union.
Thank you very much, Dr. Andy Fanji. Nice question, actually, a great question. So I'll just get into it. Well, basically, the African Union has pioneered several initiatives geared towards youth empowerment. One of these initiatives is through its African Plan of Action for Youth Empowerment, also known as APAYE. So the AU focuses on 5 key priority areas, which are employment, entrepreneurship, education, engagement, and health and well-being. These are aimed at reaching millions of youth from across the continent with concrete opportunities and intervention in those key areas. The AEC is currently implementing the Young African Program for Innovators and Entrepreneurship, where we will have an ecosystem for young African innovators and entrepreneurs to address and solve socio-economic challenges on the continent by 4 phases: sensing, connecting, nurturing, and scaling. So with sensing, what we will be doing is that we will be creating a picture by mapping to identify young people who are interested in entrepreneurship and innovation, young people who are already engaged or in the field of innovation and entrepreneurship, and those who are willing to help or to assist. And then in the connecting part, we will be linking young innovators and entrepreneurs with business development service opportunities. And the nurturing phase, we will create mentorship and supporting mechanism for young innovators and entrepreneurs in terms of providing them with trainings, capacity building, and other various business development service. And also at last, what we will be doing in this Young African Program for Innovators and Entrepreneurs, we will be providing the youth with especially youth entrepreneurs and startup owners with necessary financial opportunities. Thank you, Dr.
Thank you very much for that. Thank you very much. And with your remarks, one thing that is coming out really clearly is the power of amplifying the voice and being engaged. And with that, if you're going to map the youth, if you're going to be able to pick the youth, if you're going to create all these innovations, the youth sort of need a platform where they stand out there and they engage and they're known for the works that they're doing. And this really takes me to Helena, from the Southern African Youth Advisory Council. I just wanted to know from you, Helena, how can the youth leverage on media to amplify the voice to eradicate malaria? How can we use Facebook? How can we use Twitter? How can we use Instagram to eradicate malaria? What is the power of the media? Can you just, we have so many vibrant youth from all over the world with us this afternoon, but maybe we're underutilizing the power of media. How can we use the media to end malaria? Over to you, Helena.
Yeah, thank you so much. And I think this brings it back to the point that young people have so much access when it comes to media. And I think we are living in a generation where young people actually, we are the custodians when it comes to putting out the message and spreading the message and so forth. And one of the biggest powerful tools we have is definitely media. And we need to look at how can we amplify the message, and especially being young, we actually the ones that have to relay the message to our elders. And I think what we can do now is just to amplify on what we have. We have seen it with COVID recently. We have seen how the message went out there. We have seen how we engaged with everybody, and we used young people, we used influencers, we used personalities. And this is exactly what we need to do in order to fight this fight. What we also need to do is, I think we need to go back to the drawing board, and we need to get back to the basics, and we need to understand what is it that we are missing. Are we putting out the message across properly? One thing that I always advocate for is, and one of the speakers in the beginning said something very important, and they said that one size does not fit all. So the message that we need to make sure that the message that you're custom making for a certain audience is definitely not the same message that you're custom making for another audience. For example, the message that if I'm in Namibia, the message that I'm sending out to people in Namibia might not be received very well to the same people. It's the same message, but obviously to people in a different country. So I think that we need to go back to the basics. We need to go back to the drawing board, and we need to be, when we are in when we are busy coming up with the messages, we need to make sure that we custom make messages for people in different countries. For me, it's very, very important that we custom make our messages in indigenous languages, because I feel, yes, our message sometimes it's in English or it's in French, but if we look at the areas that are highly or mostly affected by malaria, it's areas, it's mainly in rural areas, and this is especially in Namibia. It's in rural areas where people cannot necessarily speak English. So how do we make sure as young people that the message is received very well in Divundu, for example?
Thank you very much,
we make
Helena.
sure?
Helena, I really like your
Yes.
point on having messages that are customized to the community, messages that are localized to the sort of community that you're working on. And I think at this point, I'd really just like to bring Alios in, who's the chair of the AMA Youth Advisory Council. I mean, Alios, how best can we support youth innovations? What's AMA doing to support youth-centric solutions to the fight against malaria? I like how Helen has brought up that youth having that focused sort of strategy, having that localized strategy. But from the AMA perspective, I mean, you have a very big role. You're a young person. I mean, I've worked with you with Malaria No More UK. I've seen how you advocate for malaria, ending malaria in Tanzania, and now taking up this amazing role with the AMA Advisory Youth Council. I'm building up from what Helena has just shared. I just wanted to hear from you, how is AMA supporting youth-centric solutions? Over to you, Alios. I just want to hear your thoughts, because Helena just brought up something amazing on there, and I just wanted to stop her for a minute to bring you in.
Thank you very much, Dr. Ndifanchi. And as you introduced me, my name is Alois Urasa. I'm a chairperson of ALMA Youth Advisory Council. Thank you to the previous speaker. Thanks to the previous speakers for the great ideas and inputs they've brought in. A nice discussion that's going on. ALMA is very supportive to young people, and one of the signs that ALMA is supportive is through establishment of the ALMA Youth Advisory Council that I am leading and that Elena is part of, and other Youth Advisory Council members. Another thing, ALMA has scorecard training on scorecard tools. The scorecard, these are tools that are used to manage data and bring out real-time information, and also access to data or real-time data for the fight against malaria, or also taking action in other health areas like maternal and child health, and so on, also NTDs and so on. So the scorecard training, there's a special youth-friendly training for young people, where young people can take part and learn more about malaria and other health informations, and they're even more specific into countries. So young people can get there, learn how to use these scorecards, and get more information about their countries, so that they can take informed against malaria. Again, ALMA has established youth army, malaria youth armies for every country. And we are currently on the call for youth armies. So interested young people are called to join these youth armies so that they can take action to fight malaria and amplify the fight against malaria so that we can achieve zero malaria by 2030. We have, the call is being closed today, and I think the link has been shared in the chat. If not, then it will be shared soon in the chat. So those who are interested and have not yet applied, they can still apply and become part of the youth armies who will be supported more and more into advocacy, innovation, communication, and taking action. And I would like to take this opportunity to official call for another great inclusion of young people in the fight against malaria. That's youth innovators to eliminate malaria. This is a call for young people. First of all, we are calling this aiming to amplify innovative works by young people to Africa. We are calling this to showcase best practice for youth innovations. We are calling this to connect we also connect the top 10 applications to the incubators to refine their work, to link them with mentors, to support them and connect them with finances so that they can fight their work and support the fight against malaria as young people. There will be prizes for this. Among them is mentorship. And we are working in this in collaboration with African Union Commission, you see at the youth division. And I believe that young people can bring in a lot of ideas and be amazing. And it's going to show that to the leaders that young people can do and have a lot to do. So we are calling every young people who is present here and also not present to join and send out their ideas for the challenge of youth innovators. The link will be shared soon. Welcome.
Thank you very much, Alois, for sharing that on what AMR is doing. And that builds on what Dr. Tamari previously shared. You know, the AMREF is being very, it's engaging the adolescents and the youth. It's being goal-oriented. It's doing that. It has a strategy to engage the adolescents and the youth in the fight against malaria, and not just malaria, but also other health issues such as sexual reproductive health issues, which is something that I'm also passionate about. And here, Alois has just talked about AMA opening up a call for the youth army. Now, I'd like to present to you, Dr. Esho. You know, we have all these youth innovators. We have youth that are working in different sectors, that are working as innovators. Like I said, they're working as advocates, they're working as youth mobilizers. But how can we give the youth a platform? How can we give the youth a platform to showcase what they're doing? Because we know that the youth are doing so much, but we do not have the space. We're not giving the space to showcase what we're doing. So from AMREF's side, and even just in your own experience, what do you think can work in giving the youth a platform to showcase what they're doing? Over to you, Dr. Tamari.
Thank you for your great question again. So yeah, youth can be supported in a variety of ways, and especially now that Africa is grappling with weak health systems worsened by COVID-19 pandemic. So youth can be supported by us providing spaces for innovations, and where their creativity can be expressed throughout the design to implementation of innovations in order to strengthen their own engagement within the health systems for malaria prevention, for other engagements within the health and also the health systems in general. So we've seen youth innovating even around the COVID-19. We know that there was the development of the TIBA vent mechanical ventilators that were used in health facilities in tackling the pandemic in some areas in Africa. These are some of the innovations that need to be supported and for the youth to be encouraged to continue with their creativity in these kinds of issues. We can also establish infrastructure for the youth within community and health systems for malaria prevention. And here we are looking at programs and policy that creates that opportunity for youth engagement and youth participation for innovation and to create a market for their innovations. AMREF has worked with the specific engagement around community health workers, doing community case management for malaria. And this has contributed to offloading the burden of burden of treating and uncomplicated cases of malaria through early detection and treatment. The youth make up this critical human resource. Through AMREF also, we also offer comprehensive online malaria microscopy course, and this is an e-learning course, comprises of 5 modules that is being utilized worldwide. We are also developing a malaria slide bank of well-characterized blood slides of different malaria species that will be used for training and quality assurance. So this is also available. We are also about to start a project on the new innovative PCR-based malaria test for rapid testing in particular regions in Kenya and also in Namibia, Burkina Faso, Ethiopia, Sudan, through the University of Amsterdam support. So youth can also support the social and behavior change around malaria prevention, diagnosis and treatment using social media and digital innovations. So we need to look at the youth as a critical mass of people who can support, who we can provide support to support the health systems in a variety of ways, not just as for tokenism, or they are people that we need to bring to the table for them to have that creative.
I really like how you bring that, not just using the youth as tokenism. I've seen so many organizations using the youth for events such as this, where you just want to showcase and act like you're youth, you're youth friendly, but most of the organizations are actually not youth friendly. They're going to be youth friendly for one event once a year on Youth Day, and then after that, the youth are shelved back on the shelf until the next event. And I like how AMREF is being very youth focused, and they're really practicing what they're preaching. They're really practicing what they're preaching. I've been engaged with AMREF before, and it's really amazing to see the work that they're doing. And like you're saying, we've got this powerful force on the continent, and I believe that the youth are no longer the leaders of tomorrow, but we're actually the leaders of today. Now, passing it on to Dr. Ishmael from the African Union Commission. We have so many youth innovators. We're talking about youth innovators. I mean, Dr. Tamari has just talked about CPAP, ventilators. We have seen some innovations from Malawi. We have seen, face masks. We have seen so many innovations across the globe with the pandemic. I think the pandemic has really just marked that thoughtful process in our heads. But, moving forward, how can we nurture the youth innovators? How can we nurture youth innovators, not just in malaria, but in the health sector as a whole? How can we nurture the youth innovators? Because we've seen so many innovations, but we usually do not see the end of it all. So how can we nurture this skill?
Well, thank you very much, Doctor. Well, to answer this question, I would like to share a small success story in the African continent. As you may already know, resources were stretched extremely thin in Africa during the peak of the pandemic, the COVID-19. However, I was surprised myself, to see on TV how doctors and other medical professionals, and also some young people actually on the continent were able to use pre-existing network to share information, best practices, and exchange knowledge on something with so few information, leading to less death in many countries, such as mine, such as my country, actually, Djibouti. So to get back to your question, I am amazed by the pool of talent that the African Union was able to actually bring together, representing Africa's finest in almost all fields, and mainly these are young people. So the program that I mentioned earlier, the Young African Program for Innovators and Entrepreneurs, actually has an elaborated approach to nurturing innovators in Africa. So first, what we need to do is to identify the problem. So in our sensing phase that I mentioned earlier as well, is essential to get an idea of what is happening on the continent. We need to know which issue to tackle, which areas to increase our effort on, and so on. Once we have an idea of what's taking place throughout the continent, so then the implementation phase will begin. The creation of a platform that involve youth in policy discussions will be very much important as the world is nowadays rapidly changing. Now on our nurturing phase, actually, it takes more of a direct approach to the problem. So we will provide training for innovators, create connection, mentorship among other services that may need to ensure that their innovations or business idea basically reaches maturity, and then linking them with obviously business development services. Lastly, the acceleration phase will also aim to amplify their business idea or innovations by facilitating linkage with angel investors, policymakers, among others. So yes, voila, thank you very much, Doctor. The floor is yours.
Thank you very much for sharing all the amazing things that you're working on. And I'm going to take it back to Alios. I'm a youth advisory chair. You know, we have senior leaders in the health sector today, government officials and people from different walks of life. What would you like to share with them on youth leadership in the health sector? What take-home message would you like them to take back on what the power of the youth, power of youth engagement and what the youth are doing? Over to you, Alois.
Yeah, thank you very much, Nifanche. And for that question, I'd like to say that young people have been doing a lot, and we have seen this through what the Youth Advisory Council is doing, demonstrating the power of leadership among young people. But we have seen other malaria youth, in Kenya being launched, and that young people are are giving hope to a lot of things. In the youth champions through Malaria Normal UK and Arabian partnership, doing a lot and bringing a lot on board in the fight against malaria. We saw the youth leaders for health in 1 year. There are a lot of things that brought in terms of advocacy and health system strengthening. So young people are the future, and the future is now. Young people accounts for over 60% of Africa population, and there's still a gap in involvement and engagement of young people in leadership and health at large. Moreover, I appreciate or reiterate our cordial thanks as young people to ALMA, to Malaria Normal UK, to African Union, to Rotary International, and many other stakeholders who have been seeing and recognizing the power of young people and supporting to take part and taking the lead in the fight against malaria. However, young people should not be considered as cheap laborers in leadership or cheap laborers in health improvements, but young people should be taken as equal partners. Young people should be supported. Young people should be the proceeders, the top leaders, the senior leaders should take part in mentoring and shaping these young people to become great leaders for the future. They should give them chances to advocate, give them chances to take action, give them chances to communicate and lead communications, give them chances to become innovators, as what ALMA and African Union is doing today. Call upon our senior leaders to ensure that they give us more space and opportunity to co-work and not work against us. And we represent a great number of people in Africa. So we need a great representation in everything that matters. And perhaps everything matters for us because we are human beings and we are in taking lead for the organizations, for the fight against malaria particularly. And we have a lot to bring on board. So I call upon the leaders again and again to engage young people meaningfully and strongly and support them as much as possible. But to young people as well, to adapt to the question, to young people as well, take short, as Elena has explained, the power of social medias in fighting against malaria. Show up your power and show up the potentials that you have within you. Every person has the power within. Unleash that potential. Bring out that idea that you have. Don't just hide it. Bring it out. There are so many people who can incubate it and grows and bear out fruits that will save the world. We have the power to end malaria. Zero malaria starts with me. Zero malaria starts with you, our senior leaders. Zero malaria starts with every youth. Zero malaria starts with ALMA. Thank you.
Wow, such powerful remarks from Alois. You know, zero malaria starts with me. And, you know, I like how you say that the youth need a seat at the table, but also the youth should know that we have the power to end malaria. You know, we are the generation that can bring an end to malaria. Now I'm going to take it to you, Helena. You know, what are your expectations from the African Union Commission on the support for youth innovators? What are your expectations from the African Union Commission, from RBM, from Malaria No More UK, from the AU? What are your expectations from the different partners that are fighting this fight together? What, as a youth leader, what are we expecting? You know, on behalf of the youth, what are your expectations? Just, you know, give us some ideas on your expectations, really.
Yeah, I think echoing what my chair has just said, but expectations from a young person or a youth leader. Firstly, we are young people, we don't want to take over. We don't want to take over the whole table and make decisions and do whatever it is that we want to do. We want to sit at the table and we want to be guided correctly. We want to complement with whatever measures are put in place. So for us as a youth leader, we would like to obviously get guidance, but I know where the AU and obviously all stakeholders involved have been doing their best so far. And as for young people, I think we just want to be guided and we want to complement with the measures that are already put in place so that we can assure that this fight is our fight. As we keep echoing that we are the leaders for tomorrow, tomorrow starts today. And of course, we want to make sure that we do go into that gradually with the right guidance. Also, I think I also want to open up a conversation where we need to say that malaria and the fight for malaria is not just for the health sector, that it's not just for in countries, that it's not only a problem for the ministries of health. We need to open up this conversation to the rest of the genre industries that are within the country. If we want to come together and fight this fight successfully, we need to include the ministries of, and we need to include ministries, we need to include education, we need to include ICT, we need to include everybody as a whole and make sure that we fight this together. And that it shouldn't be sidelined to say that this fight is only for health sector or this fight, young people need to do this, but we need to do this collectively together as a whole to make sure that we do eradicate malaria.
Wow, Helena, that is so powerful. You know, every 2 minutes, a child dies from malaria. The African continent as a whole is losing billions of US dollars each and every year because of malaria. You know, child absenteeism, which is affecting the health sector, the education sector. We're looking at children's lives being curtailed because they're dying. And that is also having socioeconomic effects. You know, I like how Helena has really said, this is not just the health sector fight. This is everybody's fight. It has to go beyond the health sector. You know, different ministries and departments have to partner to end malaria. That was very powerful, Helena. Now, at this point, I'm going to bring Ms. Lilies, who is the African Director of Malaria No More UK, to bring us a case for investing in a gendered approach to the fight against malaria. Over to you, Lilies.
Thank you very much, and a happy International Youth Day. Thank you for inviting me to speak about the case for investing in a gendered approach to fight against malaria. I'm indeed delighted and honored to sit among the youth today to discuss this important perspective to ending malaria. When we think of gender, or when you think of gender, what words come to mind? Let's start from there. Most likely they are words of challenge, equality, power dynamics, female and male representation. It is less likely that one thinks of malaria at the very first instance. Yet the majority of those affected directly and indirectly by malaria are women and adolescent girls. They experience differentiated vulnerabilities as patients, caregivers, and healthcare providers. And let's pause for a moment and think, are we designing malaria programming to respond to gender? Are we asking women and girls what they need? Are we asking the relevant questions in ways that they can understand and engage? Are we allocating resources towards gender and malaria? The gender narrative is our story. It is the story of numbers, of the lives of women and girls. And let's look a bit about the statistics that we have. In 2019, over 11 million pregnant women, including adolescent girls, were infected with malaria. and sadly resulting to 10,000 maternal deaths. Also quite daunting was that in 2016, malaria was the #5 leading cause of death among adolescent girls, especially between the ages of 10 and 14 years. Further on with the statistics, 70% of the global health and social care workers or workforce is made up of women. We must be bold in using the evidence, exerting our sense of humanity, and speaking out on preserving the well-being of our young women in each of our unique spaces of influence. As a community, we must more than ever before choose to challenge inequalities by empowering women and especially adolescent girls to be valued change agents in the fight against malaria. We can not only address malaria's hidden toll, but also strengthen our defenses against the current and future disease threats. Empowering adolescent girls is indeed a double-dividend opportunity. Why do I say so? When you look at malaria outcomes, there will be lives saved, improved health outcomes, they'll be informed and better able to navigate their own health care. And even more, they will be champions against the fight. They will join the youth in being champions of the fight. When you look at the gender equality outcomes, there will be increased opportunities. Full potential will be achieved, especially where you look at adolescent girls who miss a lot of school days, either as being patients or caregivers. Structural barriers will be reduced. And for a minute, join me in thinking about your community. I am sure you would attest to the data I have just shared. We must recognize the women community health workers for their unwavering efforts as the backbone of our primary health care. Yet they remain undervalued, and in some countries, as we know, in Africa, their efforts are underpaid. Our women and girls continue to sacrifice their own needs, including foregoing work and missing school, to be caregivers in our communities. Therefore, ending malaria is an unrealized opportunity for advancing gender equality in health. And when women and adolescent girls are empowered, and gender equality, we'll see gender equality improve. And greater access to healthcare will lead to lower child mortality rates and an earlier end to malaria. Unlocking the power and urgency of women and adolescent girls must be at the heart of a successful plan to end malaria. We must ensure we remain progressive and inclusive indeed. This means we must disaggregate data. What do I mean? Further research and analysis of malaria's direct and indirect burden on women and adolescent girls is needed to better inform government policies, global and national investments, and the malaria programs. We must also integrate malaria-related programs with other sectors, and it is good that that has already been mentioned by earlier speakers. We must empower adolescents in the malaria fight and put girls' needs and realities at the center of malaria programs. Dialogue with men, boys, and community leaders to remove barriers from participation and urgency at the home and in the communities. The investment case calls on governments, donors, researchers, implementers, policymakers, civil society, private sector, essentially all of us indeed, to step up and be at the lead and be intentional to look at malaria through gender lenses, to provide the leadership, the policy and advocacy programs, research and data. And let me end with the words from Her Excellency Ellen Johnson, who says, when we recognize and invest more in women and adolescent girls at the pivot of the malaria fight, the impacts will be transformational and far-reaching for both health and gender equality outcomes. And when women and adolescent girls are empowered and gender equality improves, further virtuous cycle is spurred and with great successes, with access to healthcare, leading to lower child mortality rates, and the end of malaria will be much sooner. So please join me to share gender equality to achieve zero malaria. Starts with me, with you, with all of us. So, and I urge you all to please read the full report that will be found at endmalaria.org. Thank you very much.
Thank you very much, Ms. Lilies. And that was very powerful. You really just reminded us about the role of women, you know, the triple burden that women face. You know, women have got the reproductive role, and the social responsibilities, and how a woman puts all that together and still has a fight and the energy to end malaria is still remarkable. And, you know, there's so much. COVID has shown us the power of engaging women in the fight against COVID. And we've seen the success stories from countries that are female-led. And, you know, imagine the power of engaging women in the fight against malaria. Thank you very much for that. Now, to give us a closing remarks, I'd like to invite Ms. Prudence, who's the Head of Youth and Development at the African Union Commission. Over to you, Ms. Prudence.
Thank you very much for this interesting, very interesting conversation. I've actually been here and I've been listening, and maybe even before I dive into my remarks, I wanted to make a few comments around the issue of youth engagement. And I think that the speaker spoke to the importance of moving beyond tokenistic youth engagement to actual youth engagement that makes sense and that is concrete. And I want to just add my voice to that and say that, yes, indeed, even at the African Union Commission, we're looking for that youth engagement that engages with young people at the policy level, at the programmatic level, at the institutional level. And I wanted to also really use this opportunity to applaud Alma, because I've seen a number of young people leading this, and I've been speaking to them, leading the organization of today's event. So I just wanted to say that is indeed a sign that this is a concrete engagement of young people in leading their own and being custodians of their own development. Now, on the speech that I had prepared today, all protocol duly observed, it has really been an honor for me to take part in this much needed conversation. It brings and calls for action towards eradicating the deadly disease we call malaria. There's a common African adage that says health is wealth. Building social and economic capital without addressing the health agenda makes the development agenda very elusive. I mean, we have Agenda 2063 at the Africa Union Commission, I mean, at the Africa level, really, which is really the blueprint for development. And we know that if we do not address things like eradicating malaria, we will not be able to also to respond or get to Agenda 2063 and be able to reap the aspirations of the agenda. This International Youth Day, on this International Youth Day, we raise a clarion call for African youth to join us as we build a continental malaria youth army in line with His Excellency President Kenyatta's vision to put youth at the center to defeat malaria and to address reproductive, maternal, newborn, and adolescent health and neglected tropical diseases and the broader health and development agenda. Over the last 15 years, it has become evident that a demographic dividend lens offers a strategic basis for focusing and prioritizing investments in youth. And in order to achieve sustainable development, inclusive economic growth, and to build an integrated, prosperous, and peaceful Africa, which is driven by its own citizens and representing a dynamic force in the international arena. Now is the time for our youth to translate their voices into action, and to consolidate on the progress that has been made so far across the continent to raise a youth social movement to transform our continent into a powerhouse that is becoming. I'm glad that my colleague Pardon responded so articulately to the issues and spoke a bit about our innovation program, the Young African Innovation and Entrepreneurship Program for Africa. And we really hope as the African Union Commission that young people are going to take advantage of this program and use it to show us what they have been doing in their little corners, and we can use that. And Badon spoke about nurturing, training, capacity building, and also really scaling some of these innovations that will come up from the African young people. As the Youth Division of the African Union Commission, we seek to harness the demographic dividend by empowering young people and engaging them through what we call the MOCAP strategy. This is an acronym that stands for Mobilization of Young People for Action. And this includes creating and co-creating solutions in eradicating malaria with them. We also do orientation, which is to really capacity building and training to equip them with capacity and skills, as well as mentorship. We also engage them in conversations, and a conversation like this is important for us, where we actually connect young people with duty bearers and leaders to share knowledge and experience and link them to other stakeholders to create and implement solutions. The A stands for activation. We believe that once you have been mobilized, you've been trained, and you've had conversations, but you're not activated and enabled to implement the solutions in your communities, then all that is actually goes to waste. So we also have put up some small grants. Again, I think the YAPI program that Badon speak to has an element of grants where we hope to use it to advocate, to activate young people to do things in their communities. The last A and P stands for advocacy and partnerships, where we really create the space for advocacy, high-level advocacy, that really focuses on visibility of the issue that the young people are rallying behind, as well as ensuring that we speak and we engage with partners so that we reach scale. Ladies and gentlemen, I've also noted that through the deliberations on the key role youth innovators play to address health issues, and as the dialogue focus area was on elimination of malaria through innovation, I urge young people to catalyze and sustain action in the final race to end malaria for good. The intergenerational dialogue session has been both informative and engaging, and further, given that all of us has also given us a responsibility and impertinence towards enlisting innovation as a key tenet in the development of our continent. In conclusion, I'd like to invite us all to keep the momentum in aiding youth and enabling their contributions in the fight against malaria. The growth of the innovation sector shall be enhanced, and significant opportunities created for transforming the youthful energy into new ideas by tapping into the culture and focus towards building a better future for us all. This will also provide much scope for youth entrepreneurship, which is central in alleviating youth unemployment, and together we achieve the AU vision of an Africa that we want. Zero malaria starts with me, and zero malaria starts with you. I thank you all for your kind attention.
Thank you very much for those powerful closing remarks. I'd just like to remind our audience that we have the call to apply to become part of the Malaria Youth Champions is open. And also we'll be making another call to join the RBM Partnership Joint Malaria Workstream, Youth Workstream. So be on the lookout for that as well on our different pages so that you become a part of the fight to end malaria. I've already seen that there's amazing conversation happening in the chat room. Let's make sure we keep that conversation even after this session. Like we had said earlier, this session is going to be available to download as a resource after the session. Thank you very much to our audience, and thank you very much to our panelists. And in advance, I'm going to wish everybody happy International Youth Day. Thank you very much. Have a good day.